Hi, my name is Stephanie Hertz, and I am the Marketing Director at Warwick Forest. Warwick Forest is the proud premier sponsor of CNU's Lifelong Learning Society, and we welcome you to the Riverside Lecture Series. Today, I have the pleasure of introducing Dr. Zakia Woods. Dr. Zakia Woods is an ambulatory care pharmacist at Riverside Health System in Newport News, Virginia. She works within 2 different practice sites helping patients living with diabetes, including the Congestive Heart Failure Specialty Clinic, as well as within a family medicine clinic. She also serves as the pharmacy team lead to a health system-wide initiative to improve population health quality measures for patients living with diabetes, and is the residency program coordinator for the Riverside PGY1 community-based residency. After graduating from Hampton University, she embarked on a 12-year career that exposed her to multiple areas of pharmacy practice, including working as a critical care pharmacist at the Cleveland Clinic main campus in Cleveland, Ohio, to becoming a corporate trainee for several retail pharmacies. In 2019, she decided to refocus her career as a clinical pharmacist and returned to complete a PGY1 residency with In-Clinic RX based in Raleigh, North Carolina. Dr. Woods has a vast experience overseeing multiple patient care programs, including chronic care management, transition care management, remote patient monitoring, and individual diabetes education classes. She is also a national certified pump trainer for Omnipod insulin pump system, training patients on their new equipment while implementing the self-care behaviors of diabetes education. She is responsible for the continuous glucose monitoring program, where she oversees the ordering, insurance verification, processing, training, and compliance of patients on CGM therapy. Due to the success of implementing CGM therapy with positive outcomes within her program, Dr. Woods was invited to join the National Speakers Bureau for Dexcom G6 system, where she leads topic discussions and presentations for healthcare professionals surrounding the benefits of CGM therapy for both patients and clinical practice. Dr. Woods has been afforded the opportunity to be a guest lecturer for medical residents at Eastern Virginia Medical School, focusing on deprescribing strategies for advanced aged patients, and has presented continuing education focused on diabetes at various local, state, and national conferences. She was selected as a keynote speaker for the Hampton University School of Pharmacy Annual Preceptor Conference in 2021 and 2022. And has been awarded Preceptor of the Year. In her downtime, Zakia enjoys gardening and studying Taekwondo with her 7-year-old son, where she is currently 3 belts away from obtaining her black belt. Please help me welcome Dr. Zakia Woods and her presentation entitled Empowering Golden Years, Navigating Diabetes Tech with Confidence.
Well, thank you all so much for coming today. I'm very excited to talk to you all about just navigating, again, diabetes with technology with confidence. You know, oftentimes we see all these commercials and all these great features, you know, when we go to our doctor's offices about these new supplies, and sometimes it can be a little bit challenging or a little bit intimidating, you know, when we're first told about these devices. But I just wanted to go through them with all of you and talk about, you know, some general challenges that we've come across for our patients, and kind of what we're doing on the healthcare professional side and how we can work together to overcome those barriers. So today's learning objectives, we're going to go over just continuous glucose monitors and some of the metrics that you'll see when you go to the doctor's offices for those that utilize these devices. We'll talk about different treatment goals and CGM targets across the older adult population, because it is a little bit different than what you may hear from other places online. We're going to go through the different devices that are out there on the market at this time. And most importantly, there's been 2 new wireless devices that are out for insulin pumps, and they've fairly similar, if you at first glance, but there are some key differences. So I'd like to go through the differences of those as well. And then discuss the benefits, the challenges, and then the barriers that you may possibly come across with some of these and how we can overcome them. So as mentioned in my intro, I am a national speaker for Dexcom. So I do travel the country and I do conversations around continuous glucose monitoring and diabetes related topics with different offices, again, throughout the country. And I'm also a pump trainer for Insulet, who is the maker of Omnipod. So continuous glucose monitoring. So, I'm an 80s kid. So you all may see this and remember this from your children, grandchildren, from the end of G.I. Joe, where we say, knowing is half the battle. That's what I always tell my patients, right? And patients that are on these devices. Why do I like to focus on that? Because when you're living with diabetes, we think about how we're feeling. Even when we're just gauging our general health, we think about how we feel, when we'll say, well, how are you doing today? I feel pretty good. I feel like I'm doing well. I don't have any symptoms. I feel fine. Therefore, I am fine. And I go on about my day as if I'm doing perfectly well. But when you're living with diabetes, your glucose values can be skewed very high and very low, and you may not know it. And there's even certain medications that can mask some symptoms. So it's important to know exactly what's going on inside your body as often as possible. In the past, we would utilize finger stick devices to, prick our finger, and still currently, that was the only option before, was to use a finger stick device to check blood glucose in the moment. And then from there, you can make your treatment decisions on how you would go on about your day until you would check your sugars again. But now with all this new technology out there, we're able to get more information around there. So I say that because now if you're on those devices or you have all this information in front of you, yeah, you have it, but not knowing what to do is the other half of that battle, right? So now you have all this information, you know what's going on with your numbers because you have all this data, but the question is, what treatment decisions do I make? What do I do with this information so that I can make sure that I'm living a healthier lifestyle and making better treatment decisions for myself? So common gaps in knowledge in diabetes tech. So one is, as I mentioned, just really unaware of the benefits, from the patient perspective of what you have in front of you and what you can do with this information. It may be something where the provider may not necessarily know with some of these charts themselves fully how to utilize them to the best of their ability. Not all providers, but there just may be a situation where they may see this information and not really know how much benefit they can utilize from these reports that they get from these machines from you. It may not be downloaded when you go to the offices. They may just kind of look through and, kind of punch through your machine to see your numbers. If you go and you see a glucometer, they're just kind of, hitting next to see what your number history is, versus downloading it into a graph to have a better visual. So at that point, then these devices are more used as an FYI for you, which is good. But we want to make sure that we can really take that information to the next level on the patient side as well. So continuous glucose monitoring. So this is a little bit different than, as I mentioned, doing a finger stick. So if you're familiar with, pricking your finger to check your sugars in the past, what a CGM is, which is a continuous glucose monitoring for short, is it's a device that you'll wear on your body. Typically, depending on the product, it's either worn on your belly or on your arm, and it will continuously read your glucose levels throughout the day. It's very important to know that the word blood is not in that phrase, and it's not there for a reason. It does not measure your blood. It actually measures the fluid. It's actually called interstitial fluid. I like to say that's kind of like the juice that keeps our body moving around so we don't sound like rocks on the inside. So it's just a general fluid that we have inside our body that the device will actually take a little bit of that interstitial fluid and see how much glucose is in there. From there, it'll record a trend of your information, and depending on the device, it'll upload and record that information either every 1 minute or every 5 minutes over the length of time that you're wearing that machine. There even are some professional ones that if you don't have one at home, that you can go to the doctor's office. Some doctor's office or clinic will have what we call a professional device. That's one that will apply on your body just for a limited period of time, and you'll come back to the office for us to download the information and have a conversation. So when we're looking at our continuous glucose monitoring metric, what we're really looking for in general is now time in range. Because before we would say, oh, okay, your sugar numbers are under control, because we would run what we would call an A1C, which is your lab that it's one lab and it's a good lab, but it's not the only indicator now of how you're doing with your diabetes. And we would just say, okay, well, this A1C number is under control. We're not going to do anything else. You know, we're going to keep your medication therapy as is. But now we know if someone, let's say, has a controlled A1C, which I'll get into those numbers later on in the talk, that just because those numbers say that they're controlled, that doesn't necessarily mean that they're keeping that full control all the time. And the reason for that is that an A1C measures the amount of extra glucose that's hanging around in your bloodstream over a 3-month time frame. So it's hard to really gauge really what that 3 months look like. Were you really just under control all 90 days, or were your sugar numbers running really, really high and then really, really low? And now that's just evening out to look like your numbers are under control. So now what we do is we look at, when we have, even with the finger stick machine, we try to figure out and gauge how much time you are in what we call your goal range, TIR, time in range. And from there, we want that to be a decent amount of time that you're living in, because the more that you're living in that time in range, which again, I'll get into those numbers. This is not specific for older adults, this particular picture, but I just wanted to use this visual. The more that you're in that green, which is that time in range, then the less likely you are to have any kind of diabetes related complications. Of course, I can't sit here and say that you'll never have them. I don't want anyone to say, oh, well, Dr. Wood says if I'm under range, then I'm not going to have a heart attack. I'm not saying that. I'm just saying that your risk is much lower the more that you're in range. Because, of course, you live with diabetes, there's going to be times where you will be above range. That's normal as well. So we give wiggle room for having a little bit of time for your glucose levels to be above 180. And then what we call very high, which is above 250, there's even room for that as well. Not much room, but a little bit of wiggle room to run very high. When your time is what we call below range, which is below 70, we don't want anybody really to have much time below range, because if we want your numbers to skew out of the normal range, we'd rather you run high than low, because when your numbers run low, when we're talking less than 70, so as it says here, 54 to 69 or anything below 54, that's when you can lose consciousness, you're dizzy, it's kind of hard for you to even treat yourself, to make those treatment decisions, you may need some help. So that's why in these charts, you'll see that we would rather you run high than low. So when we're talking about older adults and how we can best treat you, what we consider when we're on the back end before we come into the room to talk to you, we look at your history, and not just who you are and your age and, you know, what your patterns are, but we look at your weight. We look at, you know, what other comorbidities you might possibly have, or what made you run at risk for. What does your support system look like at home, so that when we're implementing care for you, is this something that we can make sure that you're really realistically will be able to see forward and make sure that you can be successful. So there's a lot of things that we'll look around in the background when we are looking at the right device to put you on if we're considering diabetes technology for you. So as I mentioned before, the A1C is an average, I hate to use the word average, but it is an overall snapshot of how your glucose levels are doing over 3 months. So what this chart shows essentially is based off of what percentage of time in range you would be, what your A1C number would essentially look like when we would run those labs. So as you see, the higher your percentage of time in range, the better your A1C number would be. So of course, the next question is, well, Dr. Woods, well, what is my target supposed to be? Because we're talking about these numbers, you're not really giving us any specificity of what that's supposed to look like. So now we're going to go into the different standards of care. So we have, we're going to go into the standards of care of diabetes 2023 in older adults. So again, as we mentioned, when we're making these treatment decisions, we're looking at your entire picture. We're looking at total care, not just how can we help your glucose levels get under control, but how we can help best benefit you so that you will also run a lower risk for other conditions, whether it's that, you know, are you someone that may be a little on the overweight side and we can help you with that? Are you someone that has, you know, a cardiac history and that's something that we can help you out with that? Are you someone that may have some kidney trouble? There's so many new features and new studies that have shown how beneficial some of these diabetes medications can be for you, where we can actually use them as double duty. So we want to make sure that we are looking at all of that so that we can make sure that we are custom tailoring your diabetes treatment for you. And that may be why, you know, if you have friends, hopefully you have a good support group of those of you that are living with diabetes and you have others around you. One person may be on one set of medications and it's working out fantastic for them, what's treated for them and what's customized for them may not be what's working for you, and what's working for you may, be what's beneficial. So it's all going to be different and completely customized and tailored to what will benefit you and realistically what you would like to take and, for those benefits. Other things that we want to make sure of is that we are keeping in mind the other issues that we come across with patients with older adults. We want to make sure that we're not giving you too much of a low blood sugar, because unfortunately, as the older we get, the more we are likely to unfortunately fall. So we want to make sure that we're not adding on to that. As the older we get, unfortunately, at times we may not necessarily remember things as well. We may have some cognitive impairment. And again, that just happens with all of us. So we want to make sure that when we are adding on treatment therapies, that we're making sure that if you are suffering from any of these conditions, that we're not making it any worse. Oh, I forgot about the my little technician there. Okay, so my little schematic. Okay, so when we're again talking about overall A1C targets, now we're going to get into the numbers. If you're someone that is over 65, you don't have any other health conditions, then we may want to still get you at that typical less than 7.5 to 7% as your treatment goal. Still not going to be as stringent as it may have been when you were less than 65. Less than 65, we look at your A1C to be either less than 7%, or if even more ideally less than 6.5. So it's a little less stringent, when you get a little bit older. If you are someone that has a little bit more some health conditions, so we're talking again history of heart attack, stroke, or you're running at risk of it, any kind of other comorbidities, then we do make that A1C goal a little bit higher, because our goal is not necessarily to be as stringent and tough with that goal for you. We just want to make sure that we are reducing your risk and keeping you in a more realistic glucose range for yourself. Because of that, we want to make sure that your fasting glucose will be a little bit different. So before we talked about 70 to 180 in that previous graph, as I mentioned, that's not necessarily the case for older adults. So if your A1C goal, if your physician told you that your target is, less than 8%, then we just want you to be hanging around the 90 to 150 range when you're waking up in the morning. And then when you're going to bed, between 100 and 180. And I've even seen some providers even be a little bit lax on that 180 side, depending on who you're working with. And then, if you are having even more complications, then our goal is to keep your diabetes under control and do a healthy balance between keeping your numbers under control and keeping your other conditions under control as well. And we're not necessarily focused on the numbers, we are just more focused on your comfort, and we'll customize and tailor your treatment plan based off of that. So this is the chart that I was mentioning before, where I said that I had more up-to-date information here for you. So as I mentioned, if your A1C target is 8% or less than 8%, your time in range, you don't have to be between that 70 and 180, 70% of the time, as it showed in the previous graph. You can just be in there, more than 50% of the time, we're happy. In the previous graph, it showed, or it actually showed you right there to the left, if your A1C goal is, less than 7%, then we'll give you a little bit of wiggle room between 180 and 250, 25% of the time. Whereas if your A1C goal is less than 8%, you get 50% of the time. So less than 50. This is where our greater than and less than from elementary school will really come into play, because none of these numbers will equal up to 100 as much as you try. So we have the greater than and less than. And then you still get even a little bit more lax goals with greater than 250, where you can be above 250 less than 10% of the time. So there's just more room for you to, to not necessarily be as stringent with your glycemic targets. So now let's go into the different brands that you may commonly see out there. And I'm going to go into a few that you may not have heard of, but if there's something you're interested in, you can always talk to your provider about it. So one of the more popular ones that's out on the market is the Freestyle Libre 14-day and the Libre 2. This is what we call an intermittent scan CGM. There's a lot of acronyms in this one. What an intermittent scan CGM means is that it will still read, it places on your arm, but in order for that information to record, you have to use the reader that you're given to scan the device. If you don't scan the device, then it won't record. So because of that, when you go back to the doctor's office and you're like, oh, I've worn this for 14 days, but if there's nothing on the report, that just means that there were no scans recorded. The best way for this product to work best for you is to scan it every 8 hours, because that's when the recording time will cut off. So you want to make sure to scan at least 3 times a day, every 8 hours. You can scan as many times as you'd like, but at least to get the information for reporting, for that quality conversation that I was mentioning earlier, you want to scan it at least 3 times a day. Another really cool thing about this device is that it does update minute by minute. So you can get your glucose numbers will change every minute. However, although when you scan it, it's going to record for every 8 hours, the number on your machine will not change unless you scan it again. So you'll only know what your numbers are when you scan it. It's not going to change and stay awake, unfortunately, for every 8 hours. It does have if you have a compatible cell phone, because with this machine, there are select cell phones where you can use your phone versus the reader that's given to record that information. You can have family members, loved ones that can follow your numbers as well, so they can see if you're running high or low. Some users like to use that as a safety feature, just in case if they're having any kind of difficulties, or if they live alone, so at least a family member will know, oh my goodness, her sugar numbers are low. Let's go home and let's go check to see how she's doing because she has a low number or the numbers are high. Just call to check in. There is some times where if this device does not think that the number is correct, you may, for users that utilize it, may see a little magnifying glass with a red drop of blood. And what that means is that it's asking you to do a finger stick anyway. And I will say this as a preface, for all of these devices, it's ideal to always still just have a glucometer. If you still have a finger stick machine, still have one there, just in case if there's any kind of doubt or confusion you may have. A blood sugar reading will always be more accurate than these devices. Now, these devices are extremely accurate and they go through multiple studies, but the blood one will be just slightly a little bit more. It might be a little points different. So for example, if you scan here, it may say that your sugar numbers are 112, but if you prick your finger, it may say 108. So nothing too big of a difference, but if you're just ever doubtful, you can always prick your finger to be sure. So the FreeStyle Libre 3 is their newer device for the FreeStyle Libre company, Abbott. It does, again, measure minute by minute. This one does actually, you don't have to scan the device. It does read minute by minute. And it will also give you some alarms if you're running high or if you're running low. So the moment you run high, it'll beep and tell you that you're out of range. The moment that you hit your low, whatever low number you set it to, it'll also beep to let you know you're out of range. Those range numbers can be customizable. You can make it at your low number as low as 70. If you're someone that's not comfortable going lower than 100, you can set it to 100. Or if you're someone that, I would say best practice if you're on a Libre and you don't want to go below a specific number, I would set that alarm to 10 points higher so you're getting close, just so that you can act fast before you get to that low, uncomfortable space that you don't want to be in. So the Dexcom G6 is one of the devices by Dexcom. It is a 3-piece system. So this one does have a sensor as well. This one has a separate transmitter that you have to physically install in every time. And this one you wear on your belly. This one, as you see, instead of it saying ISCGM, it says RTCGM, and that's because this one's real time, very similar to the FreeStyle Libre 3. It does not measure minute by minute, but it does measure every 5 minutes. So that's 288 readings a day. So it's still a lot more than, no one's going to prick their finger that I know of 288 times a day. So it's still a pretty good device, to utilize. With this machine, however, whether you're using the receiver that's given or if you're using a compatible phone, the number will change throughout the day without you having to scan anything. So you'll be able to see how your numbers are doing throughout the day without having to interact with it. Another really cool feature about this device is that the alarm will go off not when you hit your high or low, but before you hit your low. So it'll typically alarm about 20 minutes before you hit whatever your low target so that you can act fast. Because of that, there have been many studies have shown that patients that utilize this device will spend less time in hypoglycemia or low blood sugar, as we call it, so that they're not having to go to the hospital and treat themselves and having any kind of complications like that. This one is also compatible with insulin pumps for those that are on insulin pumps. There are 2 devices that I'll go into a little bit later on in the presentation that this device is compatible with. And from there, it'll make treatment decisions on its own where you really won't need to make too many changes within the device itself. The Dexcom G7 is the newer device from Dexcom. As you see, it's very small, kind of like the Libre, but it's a little bit bigger. The Libre, they say, is about the size of a penny, size and thickness of a penny. The Dexcom, I'd say, is maybe the size of like a silver dollar, so it's a little bit bigger. But you wear it on your arm as well. This one does not have a three-piece system. It's just the sensor and transmitters built all into one. And you can utilize your phone or a compatible receiver as well. So that's the other great thing about the Dexcom device, is that if you don't have a compatible cell phone, they do have a receiver that you can use so that you can still benefit from these features. The Eversense. So the Eversense is a device that is not very commonly out on the market, but this one is actually an implantable continuous glucose monitor for those that may not necessarily be too attracted to changing out a device every 10 days or 14 days. This one is actually something that will be inserted at a small visit at the doctor's office. They'll implant it in your arm. It'll stay under the arm for between 3 to 6 months. Once you have to do some initial calibration for about 21 days. And then after that, you don't have to worry about doing any kind of finger sticks. This one does unfortunately do require a compatible phone for you to be able to read your numbers. But the cool thing is that, let's say, for example, you leave your phone upstairs, but you're walking downstairs. There's an outside transmitter that you'll wear, or a sensor that you'll wear, and that will rumble if there's something off with your numbers. So at least you'll know something's off, and then you just go grab your phone to figure out what it is. So it's a great option for those that don't necessarily want to switch out their machines every 10 to 14 days. Again, it's not very commonly known about, but it's a pretty cool device if that's something that you would be interested in instead of swapping out over and over again. Then there's what's called the Medtronic Connect. This one's kind of similar to the Dexcom, where it does read every 5 minutes. It does actually give an even larger predictive warning. So the Dexcom will warn you if you're having a high or a low about 20 minutes before it happens. The Medtronic will let you know about an hour beforehand. And that's really, again, hugely important for people that are running low. There are 2 different versions of this. They look fairly similar, so I didn't make 2 slides. One of the slides, one of the version, which is this one here, the Guardian Connect, does require for you to do a finger stick twice a day for it to continue to be accurate with the calibration. But the newer version, which is the Guardian Connect 4, does not require calibration. But again, this one is also, you have to utilize it with a cell phone. If you do have a Medtronic pump, however, you don't necessarily have to have that phone compatibility because it will connect with the pump. So for all of these devices that I mentioned, for the CGMs at least, so I talked about all these different reports and features that we can talk about from the doctor's offices. So I just wanted to feature and highlight that there are some clinic websites that your doctor's office can utilize and may utilize to download some of your information. If you are not members of these and you have these devices, all of these websites, whether it's Dexcom Clarity or Freestyle Libre View for the most popular ones, they are free to sign up for. And you can view the information that's downloaded from your clinic, or even if you have computer access at home, you can download your information onto the computer itself for your provider to see. So it's a really great way for you to really utilize those tools, because yes, they're there for the doctor as well, when you're in your appointments to have those conversations. But the more you know about these reports, then the more quality conversation you'll have with your doctors as well. So let's talk a little bit about some insulin pumps for those that may be on some insulin pumps. So what insulin pumps, essentially what they do for those that may be on like a long-acting and a short-acting insulin, let's say, for example, popular ones would be like a Lantus or a Basaglar. So you give yourself your basal insulin to kind of cover your sugar so that your sugar numbers are not running high throughout the day. So this gives you just a little bit of insulin, just a kind of a slow wave. I like to compare it to, I say it's like if I go to Target with my shopping cart, and I don't necessarily have a list, but I'm just walking around, just slowly pulling things off the shelf that just personally I don't need. But what the basal insulin does is just slowly pulling glucose out the bloodstream throughout the day. So that's what a basal insulin will do. And then I say your fast-acting insulin is more like Black Friday sales, right? So this is like Black Friday sales before everything kind of, got a little out of control. But, when they would kind of cut that ribbon, everybody was just running like crazy and just grab everything off the shelf super fast. That's what your fast-acting insulin does. So that would be like a Humalog, a Novolog, a Fiasp, and a Pedra. So those are your fast-acting insulin that pulls glucose very fast. Insulin pumps mimic the exact same process, So it will slowly give out a basal rate of insulin slowly throughout the day. So it's slowly pulling that sugar out. And then you can actually manually interact with the device so that it can quickly shoot out insulin when you need it, which is ideally before you eat or if your sugar numbers are running too high. So it's a really great option for those that may have that confidence in that technology. When you are assigned technology like this, you would actually be set up with a trainer from that company that will sit down and walk you through how to use all of it for anyone that's interested. It would not be something that you just pick up and then, cross your fingers, good luck, you're on your own. You do get full training. And then on top of that, every single company has a 24-hour line that you can call if you have questions after hours, as well as there's always regional and local trainers available on site for if you have questions, after your initial training. So some of the popular pumps that are out, one is going to be the Tandem T Slim. So this is one of the ones, as I mentioned, is compatible with the Dexcom. So with this device, it can communicate with the Dexcom, and from there, what it will do is it will, based off of the trends that it says that your numbers are, it will slowly make some adjustments to the amount of insulin it gives you throughout the day. So if your sugar numbers are running a little bit higher, the basal rate will jump up a little bit. If your glucose levels are running a little bit lower, then it'll pull back on that basal insulin. There are two different versions. So the Basal IQ just will focus on suspending that basal insulin to stop any kind of low event from occurring, whereas the Control IQ version does the full technology that I just mentioned, where it will, increase and decrease based off of the glucose numbers. This is something that you would change every 3 days. So it does take a few days, you can hold on for every 3 days. And that's the typical average. It just depends on the amount of insulin that you utilize throughout the day. And that's all based off of weight, habit. There's so many different factors that we put into play when we calculate these out. Then we have the Omnipod. This is the other one that I was mentioning that's a pretty popular device as well. It's wireless. So a lot of patients like this one because they don't have to worry about the tubing that goes along with the insulin pumps. And you would carry around a separate receiver. There was an older version that I'm probably going to, I'd say by the end of this year when I do this talk, I'm going to start taking out that picture at the top because that one's essentially phasing out, but there's still a few small handful of people that may still have them. So the Omnipod Classic and the Omnipod Dash. So you can make multiple insulin programs if we need to. So depending on the time of day, let's say, for example, you feel like your sugar numbers are dropping too low overnight, we can change the rate so that you have a lower basal rate when you're sleeping versus when you're up. If you're exercising and you want to change that, you want a special rate for when you exercise because you feel like, maybe your sugar numbers drop more than that time, we can do that for you as well. And then there's also 2 ways that you can calculate out the amount of insulin that you'll give yourself before you eat. So there's one way, which is called, we'll use what's called the bolus calculator. And that is, you'll utilize what's called a food library. It's almost like the website Calorie King, where you would plug in the foods that you're about to eat. The machine will calculate out how many carbohydrates and what you're eating. So it takes that carb counting out of that conversation for you. And then all you have to do is plug in your sugar numbers, and then it'll tell you how much insulin it'll give you. The Dash device, which is the bottom one, that's a touch screen. It does work with the Contour Next One glucometer. For those that are on the Dash, if they don't have a Contour Next One glucometer, you can actually call up to the insulin number, which is in that should be the first or second page in your manual, and you can request one. They'll send you one for free. It does connect via Bluetooth, so just kind of just saves you a step of plugging your sugar numbers into the machine. So the Omnipod 5 system is the newer of the Omnipod system. It does look very similar to that Dash, that bottom one there. But as you see, the edges are a little more rounded versus square. So with this device, it does also work with the Dexcom. So this is the one that does have that automated insulin delivery where it will adjust the basal rate based off of your sugar levels for your Dexcom as well. But this one does it a little bit differently. So this one, based off of your glucose levels, it will adjust your sugar numbers every 5 minutes. And for that, it does not your sugar numbers, your insulin levels every 5 minutes. And because of that, we don't necessarily call it even a basal rate when you're using this. They call it a micro bolus. So it's just, they just give a little bit of insulin based on how your sugar numbers are doing over 5 minutes to try to give you as much of an accurate rate for you to keep your glucose levels under control. So as I mentioned before, one of the reasons why when we're looking at treatment decisions for you as a patient, and why you may hear your providers not necessarily talking about A1C as much as more as they used to, is because what we've learned is that there's so many different things now that have been brought to light that can affect the accuracy of what an A1C number is. Like, for example, if you're someone that has anemia, which is very common, your A1C numbers may not be as accurate. If you're someone that has a renal issue, it may not be as accurate. And it doesn't, again, as I mentioned, it doesn't really show that true story of how high and how low your numbers were over those 3 months. So because of that, we don't necessarily just use A1C as the only decision maker when we're making adjustments to your treatment plan as we used to. So now let's talk about some benefits, challenges, and barriers. So we're going to go through a couple of these clinical trials that highlighted, utilizing CGM and insulin pumps in older adults. So some of the benefits of using these, of course, as I mentioned, it will reduce your time running low. It will help you from having those excursions and running high and low, that variability. It reduces the amount of time of doing finger sticks. I do have a lot of patients that at my previous practice that I used to work at that were older adults that I would help get on these devices. And the primary reason why wasn't because they weren't keeping their numbers under control. They just didn't want to stick their finger, just ask them, and that's a question I ask all my patients, do you use, what kind of machine that they use? And if they say they're using a glucometer, to stick their finger, I just ask them, do you like doing that? Do you like it? Sometimes I'll get a yes, sometimes I'll get a no, sometimes I'll get some people that'll chuckle because they don't want to tell me no, and because they think they're going to get fussed at. But there's options, and there is a space now, and I'll mention a little later, where you don't have to be someone that is testing their sugars 7-8 times a day to qualify for these devices, because that's what it used to be. Patients that have utilized these love the fact that there's the alarms and the alerts. Especially for those that had higher A1Cs and didn't really fully understand it. I've had patients in the past that I've started on these, and then within 2 days they're calling me saying, Dr. Woods, I think this machine's broken because it keeps beeping. And I'm like, okay, well, this was, how we start the conversation. Okay, well, what number do you see on the machine? Oh, it says it's 255. All right, well, let's talk about what we ate. And we talk about the foods, and maybe based off of the foods or treatment decision or what they did throughout the day, this is why your numbers are high. The machine's not broken, it's just you feel fine, but now you're starting to learn that your numbers are running higher throughout the day than you thought they were. And that's okay. Oftentimes we just don't know until we have something to tell us. I like to say it's almost like, those 90s sitcoms where they would have like the good guy and the bad guy on your shoulder, like your CGM is like the good guy that just kind of whispers how you're doing throughout the day so that you can know exactly what's going on. There are some patients that did say that they would have, you'll see at the bottom, alarm fatigue. So again, when those devices would go off, as I mentioned, they're like, Dr. Woods, this thing keeps going off. This is where it's important to know as the patient that you can adjust those alarms so that if it's going off all the time, we don't want you to take it off. We just want you can always adjust it and make the alarms a little bit higher and talk to your doctor about it, and, or go to your local pharmacy if the pharmacist is aware of how to use it. And they can help you adjust those settings so that it's not going off as much, because we still want you to know what your numbers are. And the goal will be is that hopefully, if we have to adjust your numbers, that the alarm won't go off as much, and then we can start lowering that number the better that you're doing. Using insulin pumps in older adults. So many great benefits that have been shown in multiple trials. It helps with A1C. It helps reduce, again, the time that you're running low. Using those calculators, because it's kind of tough, if you're sitting in front of a plate and you're ready to eat, and now you have to stop and think, oh my goodness, well, how many carbs is in this plate in front of me? Like, you don't want to think about that. You want to eat. You don't want to do math. So now you have these devices that will do the math for you. So that's a great feature to have. And again, it'll give you a more accurate dose instead of just, giving out a specific shot of insulin and hoping that it'll cover what you think is on your plate. So it just gives you a little bit more treatment accuracy. One of the challenges or patients that would be, just kind of that need for that dexterity. Some patients do have sometimes changing out some of these devices. But that's not necessarily a great limiting step. There have been some studies where they've done some patient surveys, and the amount of time it takes for them to change out these devices. Yeah, it may take someone who is maybe 75 maybe 5 minutes longer than someone that's using this that's 35. But that doesn't mean, oh, well, we're not going to have them use it. It just means it takes you 5 minutes longer, and that's okay. The goal is just to get it on you. And, if you need some additional help and support so that you can do that on a more regular basis, there's tons of resources out there to help you stay successful. So barriers of technology in older adults. Again, this is where we say unable to troubleshoot some of that data that we talked about. So that's where utilizing some of those downloadable websites is really important. Not really understanding exactly what's going on. So having those conversations with your doctor if you're not understanding what you're looking at or what they're saying. Because the biggest thing is not for this just to be a great device and reports and features for your doctor, but the biggest thing is that all these devices are made for you. So we want to make sure that when we're putting you on these devices, that you understand how to use them and you know the best way to treat yourself based off the information that you have. One thing I would tell people, as you know, my first name is Zakia. For some patients, tell them this is not diabetes Zakia's management education. This is diabetes self-management education. This is about what you do, not about what I want you to do, and the best way that you can treat yourself. And honestly, the more that you look at it that way, the more successful you'll be. I've had patients make some great strides and changes, just learning really how to use the machinery that they were given and understanding what it means to make better treatment decisions. You'll learn things that, maybe we've had conversations with before in the offices about walking and exercising and eating, that you'll now start to see in real time on your machines. You'll start to see that cause and effect. And then you'll start making those changes within yourself, and you'll start self-correcting on your own. There are some issues where some patients have said that they had a hard time seeing the numbers on the display. A lot of the companies have updated that now, where the screens are more dynamic. Like, for example, the Dexcom G7. I didn't have a picture of the receiver on that one, but now it's a color screen, super vibrant, super bright, very color. So they are doing great jobs to make sure that all patients can look and see all the information that's in front of them. So one important thing, as I mentioned before, was a lot of these devices before in the past were not often introduced because of concerns of coverage. During COVID, with the limited doctor's office appointments that would happen during that time, and we were in, the public health emergency, as we called it, the Centers for Medicare, CMS, they latched down on some rules around some of these devices for patients. And they said, before, you had to have finger sticks every day. You had to be on 2 different kinds of insulin. You had to have gone to a class and all these different things that we would have to be documented. So they pulled back on that because they realized that, we as a people weren't going to doctor's offices like that because we couldn't, because everything was closed. So one of the small silver linings out of that devastation was that these patients that were given these devices on these lax guidelines had some really great results on their diabetes. And because of that, there have been multiple just organizations, companies, lobbyists that fought for and got approved to have those lax guidelines implemented. So as of April of this year, if you have Medicare, all you have to do to qualify is either be on 1 insulin injection a day, or if you have documented 2 low blood sugars. It doesn't have to be a log that needs to be submitted. This is something that, as long as your doctor has it noted in your chart. If you have Medicare, this is very important, the Medicare and the Medicare Part D plans, it is a covered product for you for the CGM devices. So just 1 insulin injection per day. Or if you have 2 noted events of having a low glucose number, so low that you needed some assistance to get your numbers to go back under control. So because of that, the access for these devices has expanded so much, and they're available for you to utilize if you're not on them. So I do recommend, if you don't have these devices, it's something you might be interested in, you're someone that's tired of giving yourself insulin shots every day, or you're tired of, sticking your finger every day, just knowing that there are options out there for you to obtain and use these devices. Once you get the devices in your hand, there are tons of resources out there for people to train you on them and to continue to educate you on it after that initial training. And that the conversations that you'll have with your doctors when you come back with this information will be a complete game changer for just the way that you view yourself and your diabetes, and will just really overall help your personal quality of life. This is my contact information if anyone wants to email me or call me in my office. And that is it for my presentation. Does anyone have any questions? Yes.
I have one question online.
Yes.
Actually, two questions.
Of course.
Are two receivers needed if using both the Deck 6 and the pump?
Is it the Omnipod pump that we're asking specifically for the person asking the question?
I believe so, yes.
Okay. So that is a great question, and I'm glad that you asked that because the Omnipod 5 ordering can get a little, what's the best word I want to put for it? It can get a little complicated, okay? So to qualify for the Omnipod 5, to use it in that beautiful mode where it can adjust your blood sugar number, and based off your blood sugar numbers, it'll adjust your insulin. There's certain, I say the stars have to align, okay? Meaning that you have to have a insulin, you have to have a compatible cell phone that has the Dexcom G6 app. If you don't have a compatible cell phone with the Dexcom G6 app, you won't be able to use automated mode. On top of that, if you want to use, because the Omnipod 5, you can also, if you have, again, a compatible phone, this is where it becomes even more specific. If you have a compatible Android phone only that has the Omnipod 5 app available, you can actually use your cell phone to make your insulin pump adjustments. But your phone has to have all of that so that you don't have to carry two devices. If your phone does not allow for the Dexcom G6 app, you won't be able to use automated mode. If your phone does allow for the Dexcom G6 app, but your phone doesn't have the Omnipod app, then you'll still have to carry two devices. So it's one of those things where, unfortunately, when we're thinking about cell phones, it's not just going to be about the speaker and the color of the screen and stuff like that. When we're thinking about medical, it may be a great idea just to go into like your store, whether it's Verizon, Sprint, T-Mobile, and just say, hey, are these apps available on this phone? So then you can make that decision of that. These are the phones that I want to buy based off of what I have. So then you're not carrying around as much stuff. I'm so glad you asked that question.
And another question, could you please discuss allergic reactions to Deck 6 and Omni?
I will. Oh, I love these questions. Absolutely. Absolutely. So again, such a great question. So because of the fact that what we're talking about, as I mentioned, are devices that are being inserted and hanging around on our bodies for 3 days at a time, maybe for a pump, 7, depending on the company, or 10 to 14 days if it's a CGM, or even, as I mentioned, 180 days for the Eversense, right? Our bodies can react to it because it's a foreign body. It's a foreign thing in our body. The way that these devices work is that it's a cannula. We say the cannula is like no thicker than like a strand of hair, is what's stuck under the skin to either push out that insulin if it's a pump, or it's absorbing a little bit of that interstitial fluid for a CGM. There are patients that do have some reactions to that, a little bit of just that small cannula going under the skin. It can cause a skin reaction, but it'll elicit an immune response. Doesn't happen to everyone, but it can happen. What a lot of the companies have done is they've changed the way that with each versions of these, and even sometimes within the same versions, they'll change either the polymer or the adhesive, or they may put a coating around some of the parts that needs to go and be inserted into your body to reduce that amount of allergic reactions. But the allergic reactions can exist. like for the Eversense, for example, which again, it's not a very common one, but that one actually has some medication coated on the outside of that device before it gets stuck into your body to keep your body from attacking it while it's sitting under there for 6 months. If you're someone that does experience those allergic reactions, there are different avenues to get around it. There are wipes that we call barrier wipes that you can use to kind of put an additional protective barrier over the skin. Some patients will put on either Benadryl over the skin, prior to adhesion. I would be careful if you do that to do the cream and not the ointment, because the ointment is greasy and it won't stay adhered to the skin and it will slide off. It's not a can, it's a will and a when. So there are so many different ways to get around it. But I would say and I have started these devices on several hundred people. I'd say I'd had only maybe 3 or 4 patients that had true skin reactions that we couldn't get around. We even once would put what's called like the Tegaderm film, like a thin plastic film, over where we would place the device, to just give it a full barrier, because really what was needed was just what needs to go into the skin. I've only had to discontinue one device on a patient because every avenue we tried stopped. So it exists. There's ways around it, and it's rare, I'd say, from my experience, of how many patients just truly can't stay on it. Yes.
Could you share your contact information again?
Absolutely.
Do you have any statistics to share on the likelihood of getting diabetes?
Oh, okay. Well, that is another loaded question. Okay, so getting diabetes is a multifold and multifactorial situation. So what happens, in lay terms, when you develop type 2 diabetes specifically? So we'll talk about, there's 2 different kinds of diabetes for those who don't know. There's type 1, where with type 1, your body may not be producing insulin at all, like your cells, what you call your beta cells in your pancreas, are not producing insulin. Or if it is producing any insulin at all, your body's attacking it like it's a foreign body, and from there, the cells die. In type 2, your body has been making insulin, but the amount of insulin your body makes over time starts to decline. And there's multiple reasons of how that can happen. One can be lifestyle. It can also be genetic. Unfortunately, it does run in families as well. And it can be a situation of no matter how hard you try, it's not a matter of if, but it's a matter of when you'll cross that threshold. And once you cross that threshold, how well you'll keep yourself under control. So once you cross the threshold, which is either having, repeated fasting glucose numbers over 126, or if your A1C number is, depending on who you're talking to in the labs, whether it's over 6.3, 6.5%, that's when they'll say, okay, you are someone that's living with diabetes now. The percentage of likelihood of patients that will be newly diagnosed with diabetes by 2030, I mean, they're looking for this to exceed like literally 30 million. Like, it's going to be a ridiculous amount of patients that they are looking to have newly diagnosed type 2 diabetes. And part of that is part of what I talked about in the beginning of the conversation, is because we feel fine, so we think we are fine. There are patients walking around living with diabetes that don't know it right now, because you won't know until you have, unfortunately, some kind of a complication. Because who doesn't have diabetes goes around checking their blood sugar? You don't do that because you don't need to, you don't think about it. It's not something you're concerned about. But because of the fact that your body's so used to having high glucose numbers, you may not realize that some of the symptoms that come about with diabetes, you may consider just to be normal things, which unfortunately they are just normal symptoms. Like, for example, fatigue. I get tired. We all get tired, but when you have high blood sugar, you can be fatigued. It can also happen when you have low blood sugar. It can cause you to go to the bathroom overnight. Think for, individuals that may have, either prostate concerns. You're already going to the bathroom a lot overnight. Is it diabetes or is it your prostate? You know, there's just things that we're not thinking about. You get hungry more than usual. You may be sitting down watching TV all day and you're snacking. Are you snacking because you have diabetes? Or are you snacking because you're just used to sitting down on the couch and eating some popcorn or eating some nuts while you're watching your favorite show? So when it comes to the statistics of patients that have diabetes or the incidence of getting it, it's really all depends on the likelihood of your family history and your current lifestyle. And then again, unfortunately, even if, let's say, for example, you're pre-diabetic or you realize this and you do everything under the moon to try to stop it, you know, especially if it's built within your genetic code for you to get it, it just may happen no matter how hard you try.
All right, I don't see any more questions and we are just about out of time.
Okay.
Thank you so much for being here today.
Yes, thank you so much for having me. Thank you.